Premier Implant Cement is a tough elastomeric implant resin cement designed to provide secure retention when desired and retrievability when needed. Premier Implant Cement was specifically designed for the unique needs of the implant-retained crown environment. It flexes under force, absorbs shock, and resists breaking down under daily occlusal stresses. The low film thickness of 15 microns allows for easy seating and an optimal fit. The resin formula creates a tight marginal seal that won't wash out. The combination of strength and durability in Premier Implant Resin Cement provides for a long-lasting hold. And best of all, the cement's performance is based on mechanical retention rather than chemical retention. This allows clinicians to safely remove the restoration at a future time for retreatment or adjustments. The non-fluoride formulation is safe for all alloys, including titanium, while the tight marginal seal helps to protect implants from potentially corrosive high fluoride environments. Premier Implant Cement is easy to use and requires no adhesives or primers. The package comes complete with an auto-mix syringe and mix tips. Before using Premier Implant Cement, ensure a proper fit of the restoration and then rinse and dry the abutment and interior of the restoration. Next, bleed the syringe, mount a new auto-mix tip, and then bleed the syringe again. This ensures proper flow of the base and catalyst. Dispense a small bead of Premier Implant Cement onto a microbrush. Brush a thin layer of cement along the inside wall of the cervical third of the restoration, or up to the cervical half, depending on the amount of retention desired, making sure to completely coat the margin with cement. This approach helps to reduce the amount of excess cement expressed apically while providing the desired retrievability. There are 1.5 minutes of working time at room temperature available. Premier Implant Cement's two-stage cure features an initial gel phase after 2 to 2.5 minutes, which allows for easy removal of any excess cement. The rigid final set takes 4 to 5 minutes intraorally, ensuring a proper marginal seal and firm retention. Excess cement can be removed safely using a Premier Graphite Implant Scaler, which will not scratch the implant surface. Natural teeth have a junctional epithelium that directly attaches to the tooth surface by way of the epithelial attachment. This creates a natural stop for excess cement. In contrast, the perio-implant tissue forms a periocoronal tissue cuff and mucosal seal with no direct tissue attachment to the implant. Excess cement can be driven down onto the perio-implant tissue and ultimately lodge against the implant. If the excess cement is not removed, it may cause perimucositis or periimplantitis. When using Premier Implant Cement, it is strongly recommended that dentists closely follow the directions for use, which emphasize using the correct amount of cement. Using the correct amount of cement is a far simpler task than having to remove any excess cement after the procedure. Radiopacity cannot be relied upon as a comprehensive detection device for excess cement. Radiopacity does improve detection in the mesial distal direction. However, the implant and abutment will mask excess cement in the buccolingual views. Moreover, too much cement can make future retrieval of restorations difficult and complex. Always use implant-safe hand instruments when working with the implants. In addition to implant scalers, Premier offers the PerioWise periodontal line of probes. PerioWise plastic probes are easy to read, gentle to tissue, reusable, and will not scratch implants. Dentists want an implant cement to be retrievable, while patients want the security of permanent cement. Premier Implant Cement satisfies both criteria, offering secure retention with retrievability. This non-eugenol resin implant cement has been successful in the dental market and has been recommended by many respected educators and key opinion leaders. Available in a standard kit and value pack, Premier Implant Cement is the ideal choice for your implant cementation procedures.